Welcome to another episode of Living with Hospice. My name is Mitch Ware, and I'm your host. I've been involved with hospice for quite a few years, both as a trained hospice volunteer and a family caregiver. You know, as I've mentioned in previous episodes, I'm a hospice volunteer. I'm not a doctor. I'm not a nurse. I'm not a social worker or a therapist. I'm not a hospice administrator. But I do have a lot of first-hand experience with several hospice organizations, both as a client and as a volunteer. And I want to share some of my insights with you. One of the most common questions asked is, how much does hospice cost? I mean, how do I pay for it, especially if I don't have any money or if I don't have insurance? Well, let's start with how much hospice care costs. The answer depends on the particular hospice organization and whether or not your loved one is using home care or inpatient care. There are several things that go into the cost of hospice services. That being said, your out-of-pocket costs are determined really by several factors, like if you have private insurance, or if you qualify for Medicaid, or if you have VA benefits, and of course, if you choose to do private pay. When we start to talk about medical care, one of the first things people ask is, well, it must cost a lot, and how will I ever afford it? The good news is hospice care is probably covered by your insurance program, as well as Medicare. Some portions like inpatient care may be covered by Medicaid if you qualify for Medicaid. The Veterans Health Administration also covers hospice care. If a patient does not have coverage, many but not all, but many hospice organizations will work with the patient and their families to ensure that they receive the support they need. Some hospice organizations give qualifying patients up to, 100% in a grant or scholarship to cover all of their hospice care expenses. One nonprofit hospice organization here in our community covered over $1 million of hospice care grants and scholarships. Now, I found this interesting. Americans' hospice costs for 2016, which was the latest data I could find, were paid for in the following manners. Medicare paid for a little over 85%. Medicaid picked up 5%. Managed care or private insurance, about 7%. And charities or self-pay picked up almost 3%. Nearly 90% of Americans' end-of-life care costs are covered by various government entities, including, like we mentioned, Medicare and Medicaid, and healthcare programs sponsored by, organizations like the Veterans Administration and private medical and long-term care insurance. Medicare, by the way, is required to pay for all medically necessary hospital and doctor care under Parts A and B, regardless of cost or condition to the patient. Now, that's assuming that you qualify for Medicare. Of the 2.7 million Americans who died in 2015, did you know 82% were Medicare beneficiaries at the time of their death? Yeah, Medicare hospice benefit has paid for the care of eligible patients since 1982. So I often ask, how does somebody qualify for hospice care benefits if they're on Medicare? Here's some of the basics. The patient must be 65 years or older. They must be diagnosed with a serious illness resulting in a terminal condition. Certification from a doctor that he or she has 6 months or less to live. Agrees to forego curative care or life-saving or potentially curative treatment. And finally, the hospice provider must be Medicare approved. So, how much coverage does Medicare cover? Well, Medicare provides care for 2 90-day periods in hospice. then an unlimited number of 60-day periods. At the start of each period of care, a doctor must recertify that the patient has 6 months or less to live. Now, I can tell you I've had patients that were on hospice care for over a year. Why is that? Well, each individual case is unique, but I think the common thread is that patients in hospice care receive terrific care. They get their meds on time, they're constantly being monitored, and they're made comfortable. And in those conditions, patients tend to thrive. Now let's look at hospice costs that are not covered by Medicare. An example of that would be room and board for inpatient care, emergency care, such as an ambulance fee or emergency room costs. Again, those may be covered by Medicaid or even a private pay or a charitable donation. Medicaid is an interesting dynamic here. Adults who meet Medicaid's financial eligibility criteria are fully covered for end-of-life care. Medicare beneficiaries who are dual eligible for both programs, which is probably 20% of all Medicare beneficiaries, can have Medicaid-covered costs that Medicare doesn't cover, such as an outpatient prescription and inpatient long-term care. Check this out. These expenses vary from state to state and from provider to provider. So you need to do your homework. You need to check it out a little bit. You may have to put on your negotiating hat depending on what state you live in. I've done some negotiating with Medicaid here in Michigan. It's not fun, but if you stand your ground and state your case politely and professionally, you can often win your case. Oh, and for the record, Medicaid and Medicare's hospice eligibility requirements are pretty much identical. A patient must be certified to have 6 months or less prognosis, and the patient must receive services from a Medicare-certified hospice facility or agency. However, Medicaid policies can vary from state to state. So again, you need to check with your state Medicaid Department of State Government. Let me reiterate this point. In addition to covering hospice services, Medicaid also pays at least 95% of room and board costs for hospice patients in a nursing home or assisted living facility. Funds are allocated to the hospice agency, which then pays the nursing facility. So let's take a minute and discuss private insurance and private pay for hospice services and how that works. Private health insurance plans vary in terms of coverage. If the policy includes hospice, end-of-life care, or palliative care, it will cover most of these costs. Not all plans pay for hospice care, although the vast majority do, since it's typically much less expensive than hospital treatment and curative care. Some policies that cover hospice care may have limits on hospice expenses. So if you have private coverage, you need to read your coverage summary, read the fine print, and call your provider to get total information. As for private pay, your hospice care provider will give you an expense schedule based on either in-home care or inpatient care. They're wonderful explaining your options and helping you navigate these sometimes treacherous waters. You know, I've noticed that there are many communities that have Medicare and Medicaid conferences. They're typically held at a hotel banquet room or a conference room someplace, and they're open for the public. Now, you need to realize going in that someone is probably going to try and sell you something. They're going to try and sell you probably supplemental insurance plans, and that's why they really have invited you. I recommend 2 ways of getting informed on hospice-related Medicare and Medicaid coverage questions. First, go online. Go to www.hospice.gov www.medicare.gov/coverage/hospice care. And if you can't remember all that, go to www.medicare.gov/coverage. And then you can scroll down to hospice care. There you can get information from the official U.S. government website for Medicare. That will explain exactly what Medicare covers, and you can get information about Medicaid from your state government website. Or, if you'd rather, every hospice has a person, and some have several people actually, that can help you navigate how to work with your private insurance, your private pay, or Medicare and Medicaid. As previously mentioned, private insurance is fairly straightforward and easy to work with. You file a claim, and your insurance provider then pretty much takes it from there. Medicare and Medicaid can be tricky, so utilize the staff at hospice to help you navigate those waters. So how much does hospice cost? Well, it depends on whether you use in-home or inpatient care. How much out-of-pocket expense is there with hospice care? Again, depends on your situation. Do you have private insurance or do you use Medicare? And if you do you also use Medicaid? Depends on if you qualify for those. Or are you going to use a private pay method? Most people have little to no out-of-pocket expense that use insurance, Medicare, or Medicaid. Can I be turned down if I can't pay? Well, nonprofit hospice organizations will not turn you away because you can't pay. And if you do not have any coverage by Medicare and Medicaid or a private insurance program, a nonprofit hospice can provide services to you free of charge as part of its charitable mission. The nonprofit status of the hospice often requires it to provide charitable services, such as this. For-profit hospices often have a foundation set aside to help with those folks that need assistance. So that's a great place for us to start next episode. We'll look at what is the difference between a nonprofit and a for-profit hospice organization. In the meantime, if you have any questions about hospice or a hospice situation, please drop us a note at livingwithhospice@gmail.com. That's livingwithhospice, all one word, @gmail.com. We may cover your question in a future episode. Thanks for spending some time with us today on this podcast. And until next time, I'm Mitch Ware for Living with Hospice. Have a blessed rest of your day.